Hello, everyone, and welcome to today's session. I now take the privilege to introduce Dr. Scott Gier, who's currently the Director of Pharmacy at Vyandot Memorial Hospital, Clinical Pharmacist at Hospice Script Services, owner of Pharmacy Consultants LLC. We are happy to have you, sir. He has completed his PharmD from Ohio Northern University and Bachelor's in Pharmacy from University of Toledo. I now request Dr. Scott Gier to proceed with the session. Welcome, sir.
Thank you. If you want to go ahead and flip to the second slide. So I'm sitting here in Ohio, USA. There's quite a buzz of activity here this morning. We have snow on the ground, and they're calling for 8 to 12 inches of snow. So everybody's anticipating being snowed in for the next few days. I welcome the opportunity to be here. This is such a nice format to be able to see so many people from so far away. The one thing I wanted to mention I have had quite a bit of interaction with people in India and students from India. Our hospital is 20 miles away from the University of Findlay. University of Findlay has students that they send here for periods of time. And I met Dr. Sekar. Dr. Sekar, as you probably know, has a student exchange where he takes students from the University of Findlay over to India. And then he also hosts groups of students from India that come to the US and spend a month at his university. And within that month, we usually host them here at our hospital for a week. Wyandotte Memorial Hospital is a 25-bed government-owned hospital. It's owned by the local government. We have a big new surgery center we just opened with a Da Vinci robot. 25 beds sounds small, but 80% of what we do is outpatient services, oncology services. Many doctors, many specialists come here and see patients. With Dr. Sekar, he was very interested in our Coumadin clinic and how we do that. Now, we have a pharmacy-driven, pharmacy-managed Coumadin clinic that we've had for maybe 10 years. And it's a good story how that evolved. We had interest in offering this service where the pharmacist sees the patient. We use a point-of-care meter with a finger stick to calculate the INR and then make the adjustments. Our local doctors here didn't really perceive a need for that, and the idea sat for a while. And then the cardiologist from 20 miles up the road asked if we couldn't offer this service for their patients just for the convenience, so the patients wouldn't have to drive in to have their Coumadin adjusted. So we started offering this service for the two cardiologists, and eventually all of our local doctors also saw how successful it was and the convenience. And now we serve all of our local doctors. We have over 200 patients that we follow actively, and they come in, and it's really a full-time position for one of our pharmacists now. And I have taken this knowledge and format and have traveled to India with Dr. Sekar. I've been there 3 times, and we've been to numerous universities and kind of walked through how that is organized and ran. And this is where this brings me to today, where I've met many of your coordinators and hosts to get this invitation. So I'm happy to be with you all today. So we can go to the next slide. So when we think about the pharmacist's role and working with the physicians, we have a very important job. Number one responsibility is to ensure the medications are used safely. This includes looking at the patient's profile, looking at the patient's disease states, and make sure that we're using the best drugs to treat those problems, and also to make sure that none of the medications the patient is taking are making the disease states worse. What things need to be avoided in disease states. Many of your diabetic medications are good for diabetes, but maybe they're bad for heart failure, things like that. Always have to keep an eye on allergy concerns and really determining was something an allergy or is it really just a side effect that someone is labeling an allergy? And then also we have to pay attention to cost. The cost of the drug is certainly a factor. It can be the best drug for the patient, but if they in fact can't afford it or won't use it or need to skip doses, that has to be considered as well. So we can go to the next slide. So I view the role of the pharmacist as somewhat of a sidekick. Here we have Batman, who would be the physician, and the pharmacist has to be content to be the helper, the support person. We're not searching the limelight. Pharmacists that want to be overshine the effort of the physician, that can create tension in the relationship between the physician and the pharmacist. If we feel the physician has made a mistake, we tell all the nurses it's a nurse's station. Though the doctor made a mistake, we need to be very professional and discreet and be supportive. Even if the doctor has made an error, it is our notice that and then get that corrected in a very professional, supportive way. And that's really our topic for today, is positioning ourselves as the physician's helper. And we can go to the next slide. So this becomes a dilemma. Once you identify a problem or a question, how do you proceed? And this is really the focus, because we want to be very artful and skilled at how do we communicate these problems back with the physician. And we can go next slide. So we have to recognize that there is positional authority. The physician in healthcare, the physician in hospital work, he is at top. He's the top provider. He dictates the care, and everyone kind of lines up behind the path that he's leading us on. Positional authority wins wars. It's how armies conduct themselves, and it also saves lives in healthcare, because the physician has the ultimate authority to dictate the care, the plan, the testing, the diagnosis, the medication. So he has that authority, and we need to recognize the pharmacist's job is not to challenge his authority, but rather to work on other ways to balance that relationship. With authority, there is positional power, but there's also relationship power and expertise power. And we can go to the next slide. Here we can see the physician has the positional power. He has the authority. The hospital gives him that authority. The medical board, the government, everyone gives him that authority. And the pharmacist, again, is the sidekick. But we can balance that power by being the expert. We need to demonstrate expertise power, but that is not enough by itself. We also have to have relationship power. We have to have a relationship, a trusted relationship with the physician, so that they will accept information and trust the recommendations that we are giving them. In the case of the Coumadin clinic, the doctor has the positional power. He is responsible that patient be on the right dose of warfarin, but he delegates that and shares that authority with the pharmacist. The pharmacist then has the expertise, the protocols, the plans, how to measure the INR, how to make the proper adjustments, and when to schedule the return appointment. Is there any drug interactions that need to be addressed? Again, the pharmacist needs to demonstrate the expertise power, relationship power with the physician, and have good outcomes. And again, not trying to take away anything from the physician, but simply to make his life easier, improve his quality of his day, and not burden him with things that are protocol driven. And we can go to the next slide. So this is a little bit of a joke where the chairman of the board says, well, I don't make the rules, but of course I do make the rules. And it is important as a pharmacist, and I've been a pharmacist for many, many years, but we always have to remember that the physician is the physician. They have the degree, they have the knowledge, and they have that authority. So we want to be supportive and not challenge them. If a physician and a pharmacist are at odds, the physician is going to come out on top. The administration of the hospital will always support the physician. So we have to just move beyond arguing, fighting with doctors. It's not about who's right and who's wrong. We have to just accept our role as the support person. We can go to the next slide. So these are some things that I have found, and I try to incorporate into my workflow. Number one, when we're working with physicians, their time is valuable. If you're hosting a meeting where a physician is to be in attendance, if it's a committee meeting, a P&T committee, infection control committee, you have to be respectful of the doctor's time. If you have to have good content that they care to hear, because we're taking time away that they could be seeing patients. So we want to be fast. If the doctor has a question, if the doctor's on the phone, we want to give them prompt attention. Don't keep them waiting. Pharmacy is expected to deal in facts. If someone asks you, are these IV solutions compatible? They do not want your opinion. They want to know the facts. So if we don't know the facts, there's nothing wrong with taking a pause and being very artistic and saying, well, I have an idea. I would like to confirm my idea, and then I will get you that answer. Don't feel pressure to blurt out an opinion only to find out later that it was wrong. Because we don't want to erode that trust. We want to build that trust every day, and that the physician and the nurse, they have confidence that that pharmacist knows the facts and gets me the information. Certainly the physician could stop and look things up and get his own facts, but it's very rewarding when he trusts you to run this information down and provide it for him. So don't fall into the trap of giving a quick opinion only to be wrong. And then the other aspect when dealing with the physicians, particularly within the hospital, if you have the opportunity, go to the physician and talk to them face to face. If there's a question, if there's a problem, if you need an order clarified, you could certainly pick up the phone and call the emergency room to get something clarified. But given the opportunity, you're better to walk down, talk to the physician face to face. You can analyze and see, is this a good time to ask this question? Maybe there's other things that require the doctor's attention, and your question is of secondary importance and can wait. But certainly don't miss that chance to talk to the physician face to face. You have a better chance of success if you're talking to him face to face. You can judge how the conversation is going. You can add more support material to your argument if you need to. You can even hand them a piece of paper, an article, something that demonstrates the point you're trying to make, whether it be a policy, any kind of written information to support the topic is welcome by the physician. Also, if you're going to talk to the physician about a topic, a problem, something that needs to be clarified, you need to anticipate what the next question may be and be prepared. So anticipate. If you try to make your point with a doctor and then he asks you a reasonable question and you don't have an answer, then it kind of dilutes and he gets suspicious of maybe you don't really know your facts. So anticipate the related questions and be prepared before you jump into that conversation. So we can go to the next slide. And this is a little bit of an illustration. So what if I don't follow your suggestion? So you have to think about that. If I'm asking the doctor to make a change, make an adjustment, what's going to happen if I don't follow your suggestion? Well, if the patient's on imipenem and we don't make the renal adjustment, they could have a seizure. And we know that this can happen. If the patient's on nitrofurantoin and we ask the doctor to make an adjustment and they don't, we know the antibiotic may not work. The bisphosphonates have to also be renally adjusted. Why is that? Well, they can be damaging to the kidneys if the patient's creatinine clearance is less than 30, to make these arguments. Enoxaparin, another drug with a renal adjustment. Well, what happens there? If enoxaparin is not renally adjusted, you can have unwanted bleeding. You have a patient on warfarin and you see an order for fluconazole. Well, this again, what if I don't address this? We have to take pause, and some of these adjustments and interactions, we have to keep it in focus. Say you're at the drugstore, patient's on warfarin, they walk in with a new order for fluconazole. Is the same doctor? Does the doctor aware that's ordering fluconazole that they're on warfarin? How many days are they going to be on the fluconazole? To what magnitude do we expect this interaction to be? So we have to not take blanket warnings and run with them. My software flags there's an interaction between warfarin and fluconazole. I should call the doctor. Well, it's this fluconazole 150 milligram times 1 dose. Maybe that's not such a concern as opposed to someone taking fluconazole every day for a week, where the interaction would certainly be much greater. We also have to always keep in mind that not everything is a prescription. So when we have someone with a liver disease, how much acetaminophen are they taking? Are they taking it from other sources? Is it hidden in with their pain medication? Is it hidden in with their cold medication? So we have to be a little bit of a detective. And there's nothing wrong with discussing things with the patient before we call the physician. Did the physician talk to you about reducing the amount of acetaminophen you're taking? Maybe they're on pain medication that has acetaminophen in it, and we know that they're going to be pushing the limit. What did the doctor tell you about this? So talk to the patient, talk to the nurse, get your facts straight before you present something to the physician as hey, this is a problem. And then also in the hospital, we have a lot of control over timing of doses. For example, we don't want to give prednisone. Do we want to give it with breakfast and supper? Do we want to give it at 9 and 9? Well, of course, if we give it late at night, it could keep the patient awake. So along the same line with these suggestions was we work towards protocols, standard administration times, automatic adjustments for renal function, automatic substitutions. So within the hospital, you have a lot of opportunity to work with your physicians ahead of time through committees and standardize many of these problems so that we don't have to interrupt the physician's day. We can take the imipenem and move it from every 6 hours to every 12 hours because we know we have the creatinine clearance calculated. So those, we can automatically reduce the dose of the enoxaparin based on a renal function. So these relationships with the doctors early on lead to solid protocols that make everything safer and move faster. And we can go to the next slide. So respect the doctor's presence. The doctor, I've known doctors for years and years, and yet I still treat them with the respect. I consider them to be my friend, but I always call them doctor. I give them the respect that is due, no matter how good a friend they are. When you're in the hospital, you're in the presence of the doctor, you should acknowledge them, you should greet them, you should offer assistance. If the doctor comes up to the department, they go to the front of the line. If you're at the nurse's station and the doctor arrives, then you should maybe subordinate any conversations and give the doctor your full attention. If the doctor brings a problem to you and it's not really your problem to solve, we don't want to hand that problem back to the doctor. If they ask you for help, you need to provide that help or take that and route that to the right person. I can help you solve this problem. So be trusted when they ask you a question, even if it's not your fault, not your responsibility. Help them find the solution or take that problem to the person that can solve that. We had a problem recently with an oncologist orders to the lab. We're not crossing over electronically, and the lab director just directed the physician, well, I cannot help you. You need to call the IT department. And that I can't tell you how wrong that is. That physician has a complaint. He has a problem. If he calls the lab should call the IT department and come up with a solution. Don't hand these problems back to the physician. And we can go to the next slide. So it's very important with doctors is to build a foundation. You don't want to be the person that the ER doctor's on duty and the phone rings and they say it's the pharmacy calling and the physician says, oh, I hate it when the pharmacy calls because it's always a problem. We want to build a relationship with a physician and have that baseline before a problem occurs. It's very important that we demonstrate excellence, that the physician trusts the pharmacist, that he knows from previous interaction that you are competent, that you are skilled, that you make good judgments. So you need to consistently demonstrate excellence. If you don't, then he's going to not trust you. If you say, I will follow the TPNs and I will make adjustments based on the electrolytes and I will manage that for you, then you have to do that 7 days a week. That is not a Monday through Friday offering. That is a 7-day-a-week commitment. So again, you have to always demonstrate excellence and get labeled and branded as a quality pharmacist. And that, again, is consistent performance. Demonstrate good judgment. And then also with physicians, acknowledge their effort. If I talk to a patient, if I talk to a patient's family, and they say good things about the physician, they say good things about their experience, I will pass that information back on. If someone comes to the Coumadin clinic and they say they were in the ER recently, I will ask them, oh, who was your physician? How was it? And try to solicit some knowledge, and then take that back to the physician and say, oh, I saw your patient in the Coumadin clinic and they were really pleased with what happened. They were pleased with your judgment. They were pleased with your concern. They were pleased with whatever, but try to find a way to build that relationship by the physician by passing back these positive comments. And again, we're building on the relationship between the physician and the pharmacist, and we're also demonstrating this expert. You can trust me. I am cautious and I am knowledgeable and I'm here to help you. So we can go to the next slide. Relationship tips. Again, build a relationship with a physician before a problem occurs. It's much better for that physician if you're on the phone that he knows your name. He knows that it's Scott calling from the pharmacy, it's Kathy calling from the pharmacy, not just a pharmacist. I've been in drugstores before. People answer the phone and they just say pharmacist. It's like, no, say your name. Make your customers know your name. Introduce yourself, wear your name tag. We want to have relationships with the doctors, the nurses, the patients. Don't just be blindly pharmacist. Let people know your name. If you have a new physician at the hospital, a new physician in the ER, introduce yourself, get to know them, tell them the protocols and services that you offer, that you automatically adjust for renal function, that you follow all the Coumadins, you follow all the TPNs, that you will call the around and reconcile the medication list, and you will bring to them any questions or problems or inconsistencies. Are there any special medications they prefer? Demonstrate service to the physician. Also, if you talk to the physician and you pick up in the conversation their wife's name, their children's name, favorite restaurants, hobbies, sports, if they're going on a vacation, anything like that, I make note in my phone. Get that physician's phone number. Ask them. Offer them your cell phone. Say, in case you need me, don't need to call through all the phone channels. Just call my cell phone. Call me on my day off. Give them your cell phone and see if they will offer you theirs. And this is a wonderful way to communicate with the doctors. And again, put this extra information in there. Next time you see them, you can say, oh, hey, how was your vacation? I remember you were going. Refresh your memory, and that will impress them that you cared enough to know their children's name. Also ask them, I say, do you like text messages or would you rather have a phone call? Texting is a wonderful way to communicate with a physician because you can text them and ask them to call you back at their convenience. Yesterday was Sunday. I had two physicians call me at home to ask specific questions. And again, that's because they had my cell phone and they know my name. So they know that they can call you any day and get your input or help on any kind of decision. Similarly, if you have the opportunity to eat with a physician, to dine with a physician, always sit back and let them order their food first, and then say, that sounds good. I'll have exactly what you're having. And that just bonds you with the physician, that you have a common bond, and they will not necessarily recognize that, but they will be, it's pleasing that you want to have the same meal that they have ordered for themselves. So we can go to the next slide. So be positive. We don't want to be a grumpy person. We don't want to be a negative person. We need to be positive in our work. It takes no effort or energy. We just have to be aware, how are we being perceived? Always make the doctor look good. Even if the doctor has made a mistake, if there's a concern, if something was missed, if there's been an error, we need to discuss these things privately. If you have a concern about a medication and you're calling the doctor's office, try to get past the person that answers the phone. Don't outline the problem with the receptionist or even the nurse. If you can just give a little bit, the minimum amount of information, and try to get the doctor to call you back or get them on the phone so you can be discreet. We don't want to embarrass the physician. It becomes a problem. He certainly doesn't want to look like there was a problem in front of his office staff. And in fact, there can be a problem. And if the physician says there wasn't a problem, then now we're stuck. So don't put the physician in a position where they have to worry about their own reputation within the hospital, within their peers, within their office staff. So again, give every effort to keep problems private. And then also, if we're ever finding ourselves at a crossroad and not knowing what to do, always keep the best interest of the patient first. What is the best interest for the patient? What is the safest for the patient? What can I do to help? So if we don't know which way to go, always default to this idea of the patient is the most important thing here today. And at the same time, being positive, we want to consider ourselves to be a super fan. Be a super fan of our employer, of the hospital, of the drugstore, of the physician. We want to be very supportive. If somebody asks for a recommendation, give your best recommendation for the people you are affiliated with, and help them gain patients, gain business, gain work. So we can go to the next slide. So this is an illustration here in Ohio. Ohio State University is well known for their football team. Last year they finished second in the nation in football, and you have a very loyal following of fans. Down below are a couple, actually they're school teachers, and they dress up and follow the team. And you have the team that is very, very famous, and now we have famous fans. And you can watch the Ohio State football on TV, and they will always show pictures of the fans. And that just illustrates you can be famous for your support of your doctor. You can be famous for your support of your employer, and it needs to be very, very clear, especially with social media. Do not put negative things about doctors. Do not put negative things about employers on social media. In fact, we've had so many people lose their job because something was put on social media that reflected poorly on the hospital, or just gave away somebody's privacy, and you end up losing your job for something that was posted on Facebook. So just stay away from those kind of controversies. And we can go to the next slide. So when you have a problem with a doctor, it's important to, I say, show them the book. I don't want it to be, I'm the pharmacist, and in my opinion, you've made a mistake. We want to give them every opportunity to see things your way, and it's easiest if you show them the book. Here is a new article. Maybe you haven't seen this yet. These new guidelines came out. Maybe you haven't seen them yet. We're trying to apply these new standards. We've talked to the neighboring hospital, and this is what they're doing there. So we want to move the conversation away from saying that you've made a mistake, that you're wrong. We want to focus on the solution. And if we take this problem to the doctor and we find a solution and they want to modify the therapy in your favor, then we need to execute the solution. So if I say, doctor, can we adjust this for renal function? And then they say, well, yes, of course. Say, I will put the order in for you. Make it very easy for them to accept your solution. Do not give the doctor multiple problems and turn them loose. If we find something is wrong, something needs cleaned up, get their approval, and then offer to execute the solution. And we can go to the next slide. So along the way, we also need to be able to work with our staff. Oftentimes the pharmacist has support staff. They have technicians. They have other pharmacists. We need to work well as a team. And we can go to the next slide. So it's very important in everything we do that the very fundamentals of our job are the key. Basic skills, basic knowledge. We need to demonstrate that excellence. If a patient comes into the emergency room and they have to be poked in their arm 3 times to get the IV started, it's going to be hard to get satisfaction from that patient, because all they're going to know is that you hurt me. So we need to be very skillful in our basic job functions and do things well, because these are the things that we're evaluated on by the public. We go to the next slide. So you are in control of your culture. Again, we need to demonstrate expert power. We need to demonstrate effort, set the pace. We also need to demonstrate compassion. If you see a new medication come in, if you see something you're not familiar with, as a pharmacist, you need to pause and review and refresh. If it was new to you, when you send it down to this nurse's station, it's probably new to the nurse, and the nurse will have questions. So if we are one step ahead and we have taken time to look at this, again, it reinforces this expert power, that we have the answers, as opposed to the nurse asks questions and you say, no, I really don't know anything about this drug. As a pharmacist, you are responsible for every medication that goes through your hands. You should know what it is, why they're on it, why is this patient on this medication. That's how mistakes can be uncovered with look-alike, sound-alike drugs. This person has high blood pressure. Is this hydralazine or hydroxyzine? This person can't sleep at night. Is it hydralazine or hydroxyzine? They have anxiety. Is it hydralazine or hydroxyzine? You need to really be critically thinking as these meds go through your hands. And if you're not familiar with the medication, you need to pause and look it up. It's also important to demonstrate compassion to your coworkers if they're having a bad day, compassion to your patients. If you have a coworker that's upset with a doctor, upset about the situation, you need to be a buffer. You need to settle things down and keep things professional. Don't let people get emotional, get angry. Keep things focused on the day's work and the benefit of the patient. Go to the next slide. So, we go through school and we recognize it's knowledge, 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 knowledge. What can we learn? What can we be tested on? But in the job world, it's mostly your people skills. The people that are the most successful pharmacists, the most successful business people, aren't necessarily the people that were the smartest. They were the people that have the best attitude, the best people skills. It's very important along this line to avoid gossip. If we're gossiping about coworkers and patients and problems, it undermines relationships and it makes people not trust you. They do not want to trust you with secrets or sensitive information. So we need to avoid that, be very professional, provide feedback to your coworkers, both positive and negative. Don't only point out the problems, also thank people and make work fun. It doesn't cost you anything to thank your coworker and to tell them they did a good job. It costs nothing. So take time to be positive and encouraging of the people that are helping you. And we can go to the next slide. So happy workers. We want people to be happy and enjoy their work. We need to acknowledge their role, even no matter if it's your technician or pharmacist, they all have a role. It's a team. You need to recognize your effort at the end of a challenging project or a busy day. I work with a philosophy that I cannot control the pay that the hospital offers for pharmacists and technicians, but we can control the schedule. So we try to be as flexible as possible. I have one pharmacist that works 9-hour days, one works 8-hour days, one works 6-hour days. It's really whatever fits that person's life at that time. People's needs change. They have young children at home. They need a certain schedule. Their kids grow up and then they can have a different schedule, but we want to work collectively as a team to offer everyone the time off that they need and a schedule that matches their home life. And we can go to the next slide. So a happy worker feels secure. If you're not secure in your work, if you feel nervous about your work, you're not going to be very productive. Happy workers have better attendance. We're going to have a bunch of snow tonight, and it's going to take some effort for people to get out, dig out their car, drive on snowy roads, and come in. But we want people to recognize that they're needed at work, as opposed to just calling on the phone and saying, hey, I can't make it in today, so you'll have to work without me. Happy workers stick around. They stay, and the years go by. It's important to recognize that every day is different. Some days are very light, and the workload is light, and we're all putting in a similar effort. Other days are harder, and we all need to work harder. We walk, we jog, we run together, whatever the day requires, but we need to make sure that everybody is putting forth a similar effort. We're all pulling together, working very hard if that's what's required, or working a little lighter if that's what the day allows. But we need to demonstrate as a pharmacist to our coworkers that we are putting in the same effort as everyone else. And we can go to the next slide. People need to feel valued at work, and they also need to feel that their work is valuable. Certainly in healthcare, everyone recognizes that it is valuable work. So as a pharmacist, it's important that you reinforce that their part is also valuable, that we couldn't do this without you. We can go to the next slide. So never pass up a chance to lead. Drug Mart is a pharmacy chain here in Ohio. There's about 50 outlets. And this picture there is Mr. Parvitz Bujay. I used to work for them, and every holiday he would call you as the owner. He would call every store and thank you for working the holiday, which was a nice encouragement. And then he would remind you to call the hospital and tell them that you're open. There was an assistant manager trainee that I knew, and he was in the program to be groomed and learn the job and eventually move up to be an assistant manager and even a store manager, managing the whole store. And this gentleman was given a promotion from being a trainee to being an assistant manager. And he did it for a period of time. And after a while, he decided maybe he didn't like that. So when the district manager came around, he asked, he said, I would like to go back to what I was doing before. I really don't enjoy being the assistant manager. I liked what I was doing before when you send me to different stores and I'd cover different problems and just float around. And this district manager said, well, let me see what I can do. Let's finish out the current month and we'll see. So at the end of the month, the district manager came back and the assistant manager, they had a conversation and he says, well, what did you come up with? And the district person told the manager that you're fired because we're looking for people that will move up and grow and take on responsibilities. We're not looking for people that want to do less. So there's a lesson there for everyone. Demonstrate leadership. Never pass up a chance to lead. If someone offers you a promotion, they offer you extra responsibilities, they ask you to do extra responsibilities, take those things on without hesitation. And don't always put your hand out every time someone asks you to do more in your job. Don't always say, well, I will do more. Will you pay me more? You need to take that responsibility and demonstrate a good job, and the pay will follow. And we can go to the next slide. So, and then never pass up a chance to learn. And that's what you're doing today. So I congratulate you for taking time out of your evening to learn. I have found that if you learn jobs, oftentimes the money will follow. With hospice is end of life care. And I was working, donating my time for our local hospice, and we meet every 2 weeks. The pharmacist is involved, the physician, the doctor, the nurses, the spiritual people get together every 2 weeks to discuss the hospice patient's plan. They had a pharmacist was required for this meeting, so I would volunteer my time to go and participate. And it literally was an hour out of my day every 2 weeks. And I did that for a number of years. Later on, a job came up with hospice scripts, and I could take that little bit of experience, 2 hours out of a month that I had done over a long period of time, and it became very valuable. And now I'm able to work in a paid position in that hospice field, working from home. I do that same type of clinical discussion and chart review from my home in the evening, and it ends up being a very important part of my income. So the job you do today for free oftentimes will pay you back later. If you get an opportunity to work in another hospital, get an opportunity to work in a drugstore, get an opportunity to help with anything medical or related, don't always stand there and say, well, what can you pay me? What's in it for me? Take that opportunity and participate. The skills that you learn today will pay you back in the future. And again, thank you for your attendance today, because you're hopefully learning things about the conduct of a pharmacist that will help you be successful in the future. So I did have a student put together a few scenarios so we can work through these cases together. And go to the next slide. So a patient was treated for MRSA with IV vancomycin. They're being discharged. The doctor wants to write for a script for oral vancomycin. What is the issue here, and what suggestions do you have for the doctor? Again, this comes up surprisingly. As a pharmacist, you're surprised to see this, but oftentimes a physician may see oral vancomycin is available and they think that it will work like IV vancomycin. And as you know, oral vancomycin is not absorbed, and it's only useful for treating C. diff. So again, you'd have to have confirmation that they're not treating C. diff, and then have a delicate conversation with a physician about, well, we can't use vancomycin orally, and then offer a solution such as linezolide that would cover a similar spectrum to vancomycin. So again, if you find a problem, investigate, and then bring the facts to the physician. And we can go to the next slide. You're in the community setting filling prescriptions for losartan. You notice that they have a serious allergic reaction to lisinopril in the past. You discuss it with the patient and severe swelling of their hands and face. What kind of reaction are we seeing? Would it be okay to dispense the losartan? And how would you approach the physician? So here we see it was not a side effect of the drug, it was truly an allergy. So the first thing to analyze with any reported allergy, is it a side effect or is it truly an allergy? And we recognize that if you have had a severe allergic reaction with an ACE inhibitor, that the ARBs are also contraindicated. So we need to verify the reaction with the patient and then have a discussion with the physician, make sure that they are aware that losartan can be a problem. Have they had any experience with other ACE inhibitors and ARBs? Verify that this is a serious reaction, and we really need to dig in our heels on this one to be sure it doesn't slip through the cracks. And we can go to the next one. Patient is in the hospital with many psych meds, Seroquel, Prozac, nausea and vomiting secondary to infection. The doctor wants to add azithromycin, levofloxacin, Zofran. What are the concerns? Well, most of your software are going to flag this as drug interactions. And again, the biggest thing here that you're seeing is every one of these medications has the potential for QT prolongation. When you see that, that's very, very tricky because it may or may not happen, but if it does happen, it can be quite serious. Obviously, if you're going to call the physician, you would want to have some alternative antibiotics in mind, some alternatives to the Zofran in mind. Certainly pay attention, do they have any other cardiac history? That would also be part of the conversation. Are they on any diuretics? Is the potassium in range? Is the magnesium in range? Other things that could precipitate the arrhythmia. So again, we want to gather up all the facts and have some reasonable alternatives to offer before we call the doctor on this. We can go to the next one. An asthmatic patient uses albuterol as a rescue inhaler, comes to the hospital for migraines. The doctor who's treating the migraines orders propranolol for prophylaxis. And again, is there any concern here? What should you tell the doctor? And anytime we see drug interactions, especially in the retail setting, the first thing we want to see is it one doctor involved or is there multiple doctors involved? And here we have maybe primary care and a neurologist. The neurologist may not have recognized or been aware that they're taking albuterol. Obviously, propranolol, non-selective beta blocker, can be very problematic. So we should probably look for other alternatives for migraine prophylaxis that are not beta blockers. Again, I would ask the patient before I call the physician, was there any discussion about this? But we don't want to alarm the patient too much and make the physician look bad. We just need to say we're going to pause and get some clarification here. But we certainly don't want to blindly let these things go through our hands, and then later on the patient has a problem. The physician counts on the pharmacy to be the safety net to detect these things and know when to pause and ask questions. So we can go to the next slide. We're working in the Coumadin clinic. A patient has been added some antibiotics, metronidazole and Cipro. Many antibiotics can interact with warfarin. Both of these can prolong the INR. So what kind of questions do you have? Well, the first question is, again, is this the same doctor that's ordering the warfarin as ordering the antibiotics? Why are you on the antibiotics? Did the doctor give you any specific instructions for your Coumadin, a dosage reduction? How long are you going to be on the antibiotics? Is it for 2 days, 3 days, a week, a month? Obviously, the longer this interaction occurs, the larger the outcome will be, the higher the INR. So gather up all this information and then contact the physician and offer solutions. Perhaps we need to reduce the dose by 25%, get an INR on the third day, and assess where it's at. Certainly, In our practice, we're very happy when the retail pharmacists call the hospital to warn us that the patient is on an antibiotic, because the doctor's office oftentimes does not. But again, this can be a very serious interaction, and we have seen that people come in with very high INRs due to antibiotic interactions. We can go to the next slide.
మనం రేపటి నుంచైనా పోదాం రా జాగింగ్.
So we're working in the hospital, and we see an order for sulcrophate for ulcers. The patient's also on doxycycline and Cipro. We need to figure out how to avoid this interaction, because you get the binding. The sulcrophate, the aluminum in there will bind the antibiotic, and we won't be absorbed. So how do we manage this? Well, the first thing we think about in the hospital is we were able to assign the times. Is there ability to give the doxycycline and Cipro early before the sulcrophate and avoid the interaction, or is the interaction unavoidable? Do we need to talk to the doctor about alternatives, putting him on a PPI or H2 blocker? We have to identify the problems and then come up with reasonable solutions. Maybe a different antibiotic would be an option, but there's several ways to go. Gather up all your information, and then if we need to ask for a change, we need to bring the problem and the solution to the doctor. And we can go to the next slide. Here the pharmacist is in the drugstore, and we see multiple antidepressants being ordered, all with a serotonin component. How do you proceed? Well, again, is this the same doctor? Is this a psychiatrist ordering all of this multiple antidepressants, or is it primary care? Is it multiple doctors? Is the OBGYN ordering something and a primary care ordering something else? So do they know? What is the indication? Is the mirtazapine for sleep, or is it for depression? Is it duloxetine for pain, or is it for depression? We need to clarify the indication for each, because maybe we can easily go away to a different drug completely to avoid the interactions. And if the doctors all dig in their heels and they say, no, we're going to go forward, then we want to certainly counsel the patient about what to watch for if the serotonin levels go up. So we have options of the duty to warn, duty to question. Certainly in the drugstore, we simply flip the prescription over and we make notes on the back of the prescription, who we talked to, what the conversation was, what the doctor asked us to do going forward. And again, duty to warn the patient. The pharmacist always has a duty to warn the doctor and a duty to warn the patient. We can go to the next slide. And that may be it. Was that it? So that was it. Gosh, and it took every bit of an hour. So was there any questions? I appreciate your time and attention today. My message to you is that it's fundamentals that are key, recognizing fundamental drug interactions and fundamental effort, fundamental people skills to make you a great pharmacist. Be very polite, be very professional, and keep the patient as your center of focus, and you will be very successful. You do not have to be the student that got all A's all through your curriculum to be the most successful pharmacist. And just because you got all A's through school does not guarantee you'll be the most successful. It's a balance between what you know and how you conduct yourself. And that is my message for you today.
Yeah. Thank you, sir. This is Karthik for taking your time out and giving a wonderful presentation. So a lot of students approach me saying they have friction with doctors in their workplace. So this session has addressed and gave us few tips on how we can develop rapport and work with them. And any student, if you wish to share your feedback, you can do now. Or if you have a question, please ask.
Well, I encourage you to take the simple lessons. To be successful in life, you just focus on doing the basic things well. Will carry you very far. I hope at some point some of you have opportunity to travel to University of Findlay, and I can see you here in the United States. And I'm sure some of you will make that trip over to see Dr. Sekar. And likewise, I look forward to the coronavirus being a thing of the past, and I hope that I get to travel to India again and see some of you at your location. So it's been very fulfilling to me to have these relationships with people from the all across the world, and I congratulate you for all seeking out a career as a pharmacist. I will tell you, as someone who's been doing it for more than 30 years, it is a wonderfully fulfilling, rewarding profession. So congratulations for choosing wisely, and best of luck as you go forward. Also, my email will be made available. I'm happy to meet people, talk with people, hear about what's going on with you. So recognize that you do have someone over here that will weigh in on any questions that you have.
Sure, sir, and we will be waiting to see you in India in maybe towards the end of 2021 with Chandrasekhar, sir. So, any one student, you can share your feedback. We have 3 more minutes before we end this session.
Good evening, sir. This is Samiksha. So most of the questions, whatever I had, got cleared out by this session, and relating actually when we feel we have the answer to the question, but we have a difficulty in approaching to the doctor or the physician present over there. So understanding the whatever the values and everything you have said, sir, we'll consider that and approach towards the doctor and get towards it. Thank you so much, sir.
Thank you. Yeah, I think that's my message. You need to go with patient focused and good intention. And the intention is not to be right, and the physician is wrong. It's to be a support person and a colleague, and you'll be well received.
So Rahna, you can share your feedback. I see that in chat box. It will be good if you can unmute and share the same.
Hi, sir. Good evening. Sorry, I have a slight stage fear. It was very amazing session as nobody was teaching us about how to deal with doctors, how to, professionally deal with doctors and how to interact with them, and how if we found some interactions and all, how we should tell them and all. It was very informative, and thank you so much, sir.
Good evening, sir. Jose here, sir. So, would like to thank you. The main point that I found amazing was that the point that you pointed out, that we should keep working on it without trying to get anything in benefit out of it. So we shouldn't see anything underlining benefit that we might get, but we should keep trying for it. So voluntary service that you told, sir, that was just amazing. So would try to focus on that more, sir, and would try to offer a voluntary service. Thank you so much.
You're welcome. Thank you.
Yes, sir. Actually, we have a small gift to you. We donated few trees on your name, and this is the certificate. So this is a small token of gratitude and appreciation from us. Thank you so much.
It's enjoyable. Thank you.
And we have like this video is streamed on YouTube. We'll share you the link, sir. You can share with your colleagues or somebody who you think might get benefit out of this video, this presentation.
Okay, that's great, and congratulations to you for the success for this venture. It's very ambitious and well received, and it will be transformative to so many of your students to cast a broad net and learn and move their profession forward quickly.
Yes, sir. Yeah.
And thank you. That is
Yes, sir.
outstanding. My daughter will be so delighted to see that the donation of the trees.
We share it on your email also, sir. You can find it on
Oh.
your email, and I can.
No, thank you. I appreciate that. Okay. Well, again, you have an open invitation as things come up in your life, and you have questions. You're building a network of people to support you, and that is a key. So thank you all.
Sure, sir. So today we had close to 150 participants from at least 140 to 50 colleges of Pharmd, and rest of them will watch it on YouTube, sir. So it definitely creates a lot of difference to them, because honestly, nobody will tell them how to approach a doctor and the importance of attitude and not just the knowledge. You are mentioning 25% it is knowledge and 75% it is attitude. So I hope all of us take that message and incorporate all the things shared. So thank you, sir.
Well, thank you. So good luck to all. So and have a good evening.
Have a good day, sir. Bye.
Thank you.
Yeah. Alvin, you can end the session.